Hello, I'm Dr. Bill White. I'm a general dentist that's done nothing but orthodontics for the last 45 years or so, and I'm a member of the American Orthodontic Society. This is an organization of general and pediatric dentists that sole purpose is teaching orthodontics to general and pediatric dentists or any other dentist that's interested in learning orthodontics. And we have a wonderful organization. We have a good journal. We have a board certification. And if you really are interested in learning orthodontics now, you can come to the American Orthodontic Society and get good comprehensive courses that will teach you orthodontics. Now, you're not going to learn it overnight. It takes a good while to do it, and I'm trying to record some of the things that I have learned in the past 40 or 50 years and pass them on to dentists that will help you in your endeavor to learn orthodontics. I want to cover a subject here today that I think really all dentists ought to know about, and especially if you're doing orthodontics. And the title of it is Molar Extraction Cases. Now, this is cases where the vast majority of them are just blown out decay, and the teeth are in real bad shape, and so we remove 6-year molars or other molars a lot of times, especially if they have second molars and wisdom teeth behind them, and we move these teeth forward into the space and end up with excellent results on this. And this is a wonderful thing to do as a dentist, and I'm going to show you several cases here today how we've done this. There's lots of different varieties and different things that we do this on. The first case here came in, and let's see, I've got to get this little deal going. In this first case, we extracted all 4 6-year molars early. I mean, the young man was quite young when we did this, and allowed the teeth to drift some. He had good second molars and also good wisdom teeth, and we'll show you how this case worked out over a period of time. Some people would think this is terrible to come in and take all 6-year molars out, but it is a very good method of treating cases like that. Now, this young man had other orthodontic problems. It wasn't just decayed teeth there and everything. He's a class 2 division 1 type person with a lot of overjet and deep bite and a whole bunch of problems, you see, coming in here. In fact, he had a defective enamel forming on his teeth. That was one reason he had such bad decay in the 6-year molars early. You can see this problem in the cuspid tooth there. See where it was forming at this particular time, and the enamel didn't form properly around that tooth. And the same teeth at various places of the mouth, you'll see the different problems. The enamel wouldn't form properly. And you see these lower laterals now, how they are defective here. And the deep bite the young man had, he had a terrific class 2, and his lower anterior teeth had over erupted and were chewing into the gum behind this upper central teeth. Now this left alone, this case would be a pretty hideous thing. You can think what would happen to this young man during his lifetime. Now I went in and patched up the upper 6-year molars so we could kind of get started, and then we came back and removed those later. Whether that's exactly what should be done or not, but it worked out quite good. We went ahead and took the 6-year molars on the bottom. You can see they're gone. I'm going to show you a bunch of Panorexes on it later. Now this was back in 1974, September 74, and we hadn't changed completely over to brackets at that time, so we were banding these teeth to start off with. And those of you that haven't treated any banded cases, maybe everybody ought to treat a few just so they can appreciate brackets. You know, brackets are so much better. It's just not funny. They're so much better. Anyway, we put bands on this young man. We were banding everybody at that time. We started changing over in 74, 75, 76. Changing. Eventually, we went completely to brackets, and well, we still use molar bands, and we may use lower anterior bands when we're putting these little fingers for stopping tongue thrust problems, stuff like that. Anyway, we were starting to line this up, and we had to kind of wait a little bit to get some molar teeth in. I used the 6-year molars for a while till we kind of could get the upper teeth started and get everything going, and then we came back and took them out. Now on the bottom we just worked back to the bicuspids, and we're expanding and lining it up and rotating these teeth and getting everything going. It took a little time doing that while his second molars were developing and drifting forward. Okay, here's the first Panorex, and I don't know that I can see the date on it, but it's somewhere around 1974, early part of 74, and you can see this young man had some bad decay in the 6-year molars all around the mouth, the whole thing. But he had good second molars and good wisdom teeth forming. And you can do so much now in bringing wisdom teeth in. If they're tilted and impacted or whatever, you can straighten them up. You can do things, and you can close space. And I think a lot of our dentists aren't really effective at closing spaces because they got into too much non-extraction, thinking you never did need to extract teeth. Well, there are a lot of cases that do need extraction, not a whole lot of them, but not near as many as they used to do. But there are definitely cases that need to be extracted. Anyway, we have 4 bad 6-year molars here, and it's a shame. I mean, many dentists would, maybe if they extracted this, they'd put an implant in and then extract the wisdom teeth, and that is so ridiculous. You know, you can move this tooth over in that hole, and you can't tell the difference in it when you get through, and this whole thing will come over, and I'm going to demonstrate that in this case. And I hope to goodness dentists, especially those of you who are doing orthodontics, if you don't know how to close space and move teeth around in the arch without dishing the face in, it's even easier now where you can put these little tads in. If you don't want this to go back and you want this to come forward, you can put a little screw in the cortical bone right there and then bond it to these teeth, and they'll pretty well stay where they are, and you can move these teeth up. I've shown some cases where we did that in all this bunch of slides we've got coming out for people to study. Okay, so we took the lower molars out first, and they'll be drifting forward during this process. Now you can see already by the third panorex here, about half or maybe even over half of the space is closed too. These teeth are moving up. Now the uppers will close a little faster than the lowers will here. And we'll come back and we're going to get the upper 6-year molars out also. And you can watch this. Some people criticize it, but to me it's darn good orthodontics, and I want to more or less prove that to you. Now here's the fourth panorex. I don't have the date up here where you can see it. I think it was written on there in pencil. But anyway, the space on the bottom is already together, and we extracted the upper teeth, and now that space is together. And the teeth are tilted. Some people will say, oh God, you know, the teeth are tilted over like that. It is so simple to upright the teeth, to straighten them out, and many people don't know how to do that. So anyway, watch this take place now. And here it is a little later on. Now we've closed the space completely on the bottom. The upper space is, they've got a gap in here, and this will line up as we go along. It'll get better. I don't know if we all got it all perfect, you know, before we get through, but my gosh, it's so much better than what the young man would have ended up with, of course. All right, here it is a little later. This one is moving forward good. This one is still got quite a little gap. The sinus dropped into this space, looks like. The bottom, you can hardly tell it from a 6-year molar now. So just continue to watch it. Now the space down below is just virtually gone at this time. This is 1981. This is several years after we finished the young man. He said 74. That's when we started, and it took us, we worked on about 3 years. We didn't have any molars there to work with for a while. Now the teeth on the left side of the mouth are pretty well paralleled, and then we've got this little problem on the right side of the mouth, which really doesn't amount to anything to speak of. And we've got him in a good class 1 relation. We corrected the class 2 problem. Now we're not trying in this series to explain all of how we corrected the class 2 and everything, but we're just demonstrating or showing you what can be done by just eliminating bombed out molars, or you can eliminate them for other reasons, for reducing the vertical height of the face, which we're going to do a case like this after this case. Now here it is in 1991. This is from 74 to 91, and you can look at this and it looks darn good. This guy's sensitive to decay. He's had a bunch of it. This gap, the sinus, is still down in there, so it's stayed, but the teeth are lined up quite well. This was working better on the left side of the mouth, and the teeth, the roots and everything. And I guarantee you that very few dentists will recognize that this is a second molar and a wisdom tooth here. I mean, you'd give him, take him to a whole group of dentists and let them examine it and tell them what they have, and there'd be very few people who would say that this is a second molar and a wisdom tooth. The 6-year molar is gone, you see. So anyway, you can do that. You need to learn how to move these teeth around. Here's where the guy was, a class 2 division 1, pretty bad, 70. That was 5 of 74. And here it is, January of 81, after we had finished it and taken the braces off, and it's been some time like that. Now here, this is 1977. We've got a little bit of a midline deviation in there after we finished. We didn't get that just ideal, but I don't worry about midlines if I've got the teeth interdigitated ideally, and I'm not saying that I do, but this is so much better than what this young man would have suffered his whole life through. Now this gives me a wonderful feeling. Doing orthodontics is something that I just loved doing. I mean, helping people to think that you could come along with a little glue and a few little brackets that you can hang on to teeth now, and a few wires in there, knowing something to how to do it, and can change the whole life of this young man to a far, far better situation. And to me, that's a reason for being, you know. And that's why I'm continuing to teach orthodontics and have spoken all over the country and many places in the world on orthodontics, trying to teach it to general dentists as well as pedodontists, and we've had some orthodontists come take the course. In fact, I teach with one of the outstanding orthodontists now, Dr. Larry White, and I have taught for years together. And we're getting orthodontics now where it's available for most everybody if they really try, really are interested now. Some of these government programs are they just don't pay you enough to do real good crackerjack orthodontics, but it's being made available for people. Now, here it is, 1977. It looked good, but I don't think his wisdom teeth had gotten in at this point. See, we still don't have the wisdom teeth back here, and we'll watch him. And I think in 81, the wisdom teeth made it in, and if they hadn't have come in pretty good, we could have gone back and tilted them up or uprighted these teeth, if whatever you want to call it. Very simple to do. Now here it is in 1981. He's not doing the best brushing job that I would like for him to be doing, but the gums are a little inflamed right here, but the wisdom teeth have come in now. And you can see the lower wisdom teeth. Everything's lined up good. Now, when we see the wisdom tooth dropping in here, it'll hit and level this thing out over a period of time. You can see the slides later in 91. And how much better this is than having implants or whatever you would stick in there and extract the other teeth and come back. And this guy's got his own teeth now, and its profile is good. It was pretty good to start with, though, even though he was a Class 2 Division 1. And the vertical height of the face worked out real well. Taking the 6-year molars, the vertical height tends to lower some, even if they're got a tongue thrust problem or some mouth breathing problem. It works better. Good smile line, everything. Now here he is, 1991, and he parts his lips. You see the teeth good here, and it got a good smile line. Doesn't show the gum tissue. I didn't have too much to do with that. That just worked out good like that. Now here's what he had to start with, and there's what he ended up with. And it just takes a little bit of effort and a little knowledge on the part of the dentist or the orthodontist or the pedodontist or whoever the heck's straightening their teeth. Need to know how to slide these teeth around, put them in position, and save the good teeth and get rid of the bad teeth. That's just what I'd like to see people do. And here's 91. We took those teeth out, and I guarantee you that 9 out of 10, or maybe 99 out of 100 dentists would never know that he has no 6-year molars. You think, well, we reduced this. The vault up here was narrow. He was pushing his tongue out through there. We widened that out, and his tongue stayed in the mouth, and it's staying in this different width. This is a much better arch form than this is right here. At least I like it better. I don't know that everybody wants them that way, but that looks better to me. Now, 91, we got some relapse right here in the front. I didn't put a bonded 3-to-3 in there, and that would have been better if I'd have done that on him. But anyway, we got a little flaw in there, but nothing that's gonna mess this up. That's that 19, let's see, 16 years after we started the case. And I'm sure the young man still has these teeth lined up good. There was something wrong with the way this tooth hit up above here, and not having anything holding that, this tooth moved as the case deepened a little bit. So that's a flaw. It's probably my fault for not bonding something. All right, here's another case, and we took all the 6-year molars were removed to help lower the vertical of the lower third of the face. It was just slightly high. Now, this is a questionable case. I mean, you don't have to do that, but I wanted to lower this vertical down and get this chin up about somewhere along there, and it's very difficult to do. This is rather drastic treatment for that, so I'm not totally recommending it. It's not all that high anyway. But we took these teeth out, and then you watch what happens to it after we finish it. Now we got a little class 2 problem here, not bad. Little class 2 division 1, where the upper teeth are sticking out, and we took the 6-year molars out. It's a 6-year molars, I'll say, are excellent teeth to remove to get the vertical dimension to go down. If you've got the problem that caused the vertical to open up to start with, like a mouth breathing, tongue thrusting, lip biting, and finger sucking, and different things that cause you to get too much lower third of the face. But anyway, we took the 6-year molars out. Now, a lot of people are going to say, oh God, that's terrible. But we had wisdom teeth, and we had 12-year molars. So I want to show you what happened, even if you think this is drastic sin to do this. So we got a class 2 division 1, and we removed good 6-year molars this time. So I've got a space here for somebody to criticize me quite a bit. All right, here's the case starting off, and this is in 01, and we've got it getting down pretty close, lining up the teeth, and we come in and take these perfectly good teeth out. So a lot of people are going to condemn that, and I can see this is not something that you want to do every time, but it lowered the vertical dimension of the face. All right, we put the brackets on and went through the orthodontics, and now we'll close the space up, and as we close the space, we correct the class 2 problem. We put some fingers on the lower anterior teeth to work with the tongue thrust that the child had, and we got the space just about together. I think I'll show you a group of panorexes here that will help. This was 1996, and we put these little fingers on the lower anterior teeth, and we come in and recommend removing the 6-year molars to get the vertical down. Alright, here the molars are removed, and now we'll slide the second molars forward, and we'll bring the wisdom teeth in behind them. Now, a lot of people would say, well, you don't have a guarantee that the wisdom teeth are going to come in, and that is a possibility. But the vast majority do come in. And so we close this space up. We stop the tongue thrust. We stop the reason for the high angle. And we remove some teeth that allow the bite to close down. And now the wisdom teeth are going to come in. And you can see here's 03. It's closed to some extent. And this is, she's aged 11, I think 11 months, and it's age 11 and 8 months at this point. Alright, here's 07. We apparently finished the case, and the teeth are lined up good. Got a little gingival problem here that's not being taken care of. The wisdom teeth haven't come in. Well, the upper one, they're coming in on the bottom now too. This one is in, and that one's coming in right there on the top. And we bonded these teeth together, and here's her facial structure after we finished. We did lower the vertical dimension on the case. We have a maybe slightly flattened facial structure, good smile, a little bit on the gumminess, but if we taught her how to stretch her lip down and not show the gum, she could make it look a little better. So even though that wasn't an ideal extraction type case, that you can still make it work out like that. Okay, the third case is extraction of the first molars on the left side only. Now this young man had one that was blown out on the left side, so we took the tooth on the left. Now this will make a midline deviation. The whole face is going to shift a little in that direction, but it won't be bad. It's crowded and everything. So we'll come in and take, then the molar on the left was badly broken down, and I don't know whether the nerve was involved or anything, but we took one tooth on the left, and the bottom left also was bad. So we took those teeth out, and we kept the wisdom teeth. So here's the Panorex right here. We just eliminate, see this one had the root canal, so you're crowning and doing a lot of things with this situation. So we just took those out. We moved this in. This came in, filled that in, and have a slight deviation in the facial structure to the left because of that. And then we had to eliminate these wisdom teeth on the other side of the mouth. Okay, here it is on down the line. We've closed up a good bit of the space in 1975. Let me see, I'll jump 2 slides there. Alright, people would look at this and this, you know, if we needed to, we could save that tooth, but you don't have any room back here. So we decided to go ahead and take the wisdom teeth out on that side. Now we have plenty of room over here. You say, well, oh God, this is leaning over like this, and we'll have to do something to try to straighten that tooth up. We've learned how to straighten these teeth out, and it's really quite simple. Really need to parallel these roots better too. Okay, here we put that little bracket on there and run a wire there with a spring, and this spring is down like this, and we break it up and hook it up here, and then you can activate it even more, and you can just kick that tooth right out of that hole. It'll bring it right out of there, no problem. We've done lots of those teeth like that, and we have a whole series showing you how to upright teeth like that. Alright, this is a terrible Panorex, but you can see we've got that thing working on that tooth, and here this little bracket was back here. We've got the tooth setting up like that now, and here it is later on. The tooth is perfectly lined up in here, and if you don't know how to do that, we have a series on uprighting teeth. You ought to get in and go through it. It'll show you how to do that in detail. So here's finished up like that. Extraction on one side only, and it works out pretty good. Now it's got a little slight deviation to that side of the mouth, and if you know it's there, you can recognize the facial structure. Then the rest of it's just regular, simple orthodontics. You see, we're closing that space. We've got to wait a little bit for the wisdom tooth to come in back there, and we'll close the rest of the gaps up. So here is 1997. That was 94 when we started, and that's getting down pretty close. The anterior part of the mouth looks pretty good. 94 to, that was 6 of 94 and 4 of 97. So it was 5, 6, and 7. It's taken some time to do the case. Okay, here we've extracted the tooth, and you can see we've closed the space up. And here's 97 again. If you look at it here, if you look at it very carefully, you can see a slight deviation in the midline of the palate. It kind of curves to that side slightly, and there is a difference in there when you do a molar on one side and nothing on the other. Now on the bottom, 97, we have to close the rest of this up, and it'll be tighter over there. I hope we closed all that space up. Now the hooking up the wisdom tooth, we had to put a separator in there and get it done. Alright, here's in 98, and you can see the difference in the two sides of the teeth. Here's 99, we've completely finished the guy, and you've got a definite difference in the side where the molar was removed. And we got the space together, bonded this together. Here's the young man after he's matured. He's got a little candid smile, and it doesn't look bad, and that worked out quite well. Now we've got the fourth case here, extraction of lower first molar only, and without taking anything on the upper. It's showing you can do all sorts of things with this. And this wasn't a class 3 case. Now this young lady comes in, has some bad 6-year molars, and we had an impacted cuspid, and so we have to jump the lateral cross bite, and we take out the lower 6-year molars. And we're taking a lot of time, so I'm just going to run through this quite fast. We've got an impacted, looks like an upper right cuspid in there also. And so we've removed the lower 6-year molars. We move back till we get to class 1 on the lower anterior, and then we try to hold that and pull the molars the rest of the way forward. When you look at the Panorex, you see why we wanted to do this. Now, a lot of people look at this and say, oh God, I don't want to mess with that. That is not a problem if you learn how to upright teeth. You can straighten those teeth up quite easily. And so I hope that whoever you are, if you're reading this or getting this tape, and I'm talking to you, I'm drawing it on here, and I hope to God you can do it and learn how to do it if you don't, because that's what really needs to be done. You don't need to come in here and put a dead gum implant in here and then extract that tooth. To me, that's utterly stupid. So forgive me for that. But do try to learn how to upright molars like this. It is not difficult to do, believe me. Okay, now we go ahead and we take those teeth out. We start closing the anterior part together. And if you get these teeth back where you want them, if you want to put a little tad in the cortical bone and bond it to the bicuspids, then the rest of this will come forward right here without pulling it. Now watch this tooth as we go in there. That will throw a kink, and most people would not want to mess with that molar like that. Alright, we get it coming over there, and the molar's still laying down. Don't worry about it. We put a little spring in here, cocked it up, put it on there, and it just sets that tooth up beautifully well. If you don't know how to do that, just get that series on uprighting teeth, and it'll show you how to do it. Don't have time in this one to go through that. And there's the tooth. It's set up, the bone's good on it. Now you can extract the upper wisdom teeth if you want, but these are wisdom teeth and second molars wisdom teeth in there. Alright, here's the young lady, 1986. And the rest of it's just regular orthodontics. You don't have to spend a lot of time on that, but I want you to be willing to go in here and stick your neck out a little bit and try to close these spaces up on people. So this worked out quite well. There it is, 1982 and 1991. These teeth were discolored to start with, so we didn't cause them to be discolored by moving them around like this. Okay, that's the impacted tooth is in there. And the facial profile, everything looks perfectly fine doing that. Alright, this next case is we extract 3 first molars. The other one was missing already, so we didn't have to take it out. This young lady comes in. She's got other orthodontic problems and stuff like that, but we want to get these teeth out, and she has wisdom teeth back there to fill in the spaces, and so we extract these molars. The molars are pretty well broken down, got other orthodontic problems. We won't try to answer all those questions right here, but they take these 3 teeth out, and the upper one is already removed, and it's drifted. It must have been removed when she was quite young. Now one of them wasn't all that terrible bad, but we took the others and we got wisdom teeth and everything, so we decided to take this too, and now we'll bring this together, and then we'll use the other up above. And that was 1978, I think, when we started it. And we lined everything up, pulled those molars forward, and we're waiting on the wisdom teeth to come in. And if they tilt over, we know how to straighten them up too, so hope you'll learn how to do that. And I'm going to run through it pretty fast. And there's the situation. We pull those molars up in there. Learn how to close space in people's mouths. You can do it. We've got several series on closing spaces, showing you how to do that, showing you how to upright the teeth. And this is good. Those are second molars there in place. Those are second molars on the bottom, and the wisdom teeth come in back there, and they're all right. This is another case that I'm gonna just jump through real quick. We've been at this over 40 minutes now, and people get tired of listening to you, so I'm gonna quit. But this is another case. We've got teeth behind. We take teeth out, move together, we straighten them up, slide them in, we straighten the wisdom teeth out, close it up, and I'm gonna see if I can stop this at this point. But I hope each one of you will, if you don't know how to close a space and you're afraid to take 6-year molars out, do try it. It works quite well. And I want to stop this now. I hope it stopped it. It's still going.